Okay, hi everyone. So we're back with another one of our IC4CH spotlights, and today I'm delighted to be joined by Lwin, who is a professor in the Week and We School of Communication and Information, and joint professor at NTU's Lee Kong Chian School of Medicine at NTU in Singapore. So thanks, May, for joining me today. It's great to get the chance to talk to you about your work. First, I'd like just to ask you a kind of a broad question, I guess. I know you've been involved in lots of different health communication projects over the years. Could you share with us some details about one key study that you've conducted in the area of public health, which I know you've worked in a lot, and maybe what you think is unique about that study?
Yeah. Thank you so much. Thanks, Gavin, for having me on this show. And you probably heard a bark right now. I've got my dog who is super clingy and sitting here next to me because it's late in the evening in Singapore. So thanks for bearing with her. If she barks again, I'll try to let her out.
Oh, it's okay.
But
I couldn't hear her, so it's
yeah.
okay.
So Gavin, your first question, was really about what would be one of the projects that really stood out, right? And I've been in health communication for, I guess, coming up to about 2 decades now. And really one of the projects that's closest to my heart is a project called MOBAS. It is about a warning and information system for communities surrounding issues of dengue, which is I guess in some of the Western countries, it's known as dengue fever. It is a mosquito-borne disease, and it's very common here in the tropics. So we set out to use mobile phones, which had become very common in tropical countries, especially here in Asia, to see if something that we call participatory surveillance could be could be brought to communities to share with one another about where the mosquito threats might be, where there would be particular concerns around mosquitoes, and how the public sector, the government, can then be more focused in their efforts to take action. So it's an interesting project because we launched this in Sri Lanka, and it was kind of way before a lot of these digital apps and technology that you see in COVID became commonplace. And yet it worked beautifully in the community. We were able to make a difference in terms of the dengue incidents. And we had so much learning experiences from there that we've been able to bring it to other countries and other population groups as well.
Oh, it's fantastic. And I'm glad you shared that project because, well, we spoke recently. I think I've seen you present on the project a few times over the years, and seeing how it's evolved is really amazing, and the impact that it's made. And you mentioned there that obviously, I know you're based in Singapore, but you did the work there in Sri Lanka, and you've worked in other places as well. And that brings me really to my next question. I know that you recently set up the center, the Asian Center for Health Behavioural Insights and Interventions, that the Habits Center, if you like. So could you share a bit with us about your motivations for creating that, and what you hope to achieve through the Habits Center in the future?
Yeah. Thank you. Habits was just founded last year. And it's unique because I think in my work with so many healthcare providers, government institutions, and even community partners, we do notice that sometimes a lot of the research that we do in academia, scientific institutions, sometimes is not very easily translatable to real time utilization. So HABITS is Singapore's first unique academic and clinical unit for health behavior insights and interventions. So what it does is that it actually brings the clinicians alongside the scientists and researchers, and we're able to bring knowledge to translatable spaces very quickly. So it plugs key gap in our national population health ecosystem here in Singapore. And we also really strive to share our findings and the knowledge, especially about Asian populations, with the region and some of our neighboring countries as well.
Mhm. That's really interesting and really important work. And I think you're so right that translating research into real world benefits can be really challenging. So I think having a centre dedicated to that in the Asian context is really worthwhile, clearly. Um, and on the back of that, could you maybe tell us a little bit more about maybe some of the other work that you've done focusing on the Asian context? For example, some of your work on doctor-patient communication in Asia, which is an area that I know that you've been working in.
Yeah, it's really interesting to look at health and healthcare in Asia and see where there are so many similarities and yet also differences with a lot of the scientific research that's been done globally. We do know that, in many of our work, for instance, in infectious diseases, what we experienced during COVID and so on, we were able to see how Singapore, face similar issues with regards to areas like vaccine hesitancy and wearing a mask, and there are a lot of interesting aspects about our studies which mirrors what's happening globally. But at the same time, we have so many insights, and so much of our research shows the unique cultural and societal even heritage differences that creates different types of health behaviors and their approaches towards health that needs to be considered. So in that space, maybe I can share like two projects, right? So the first one that comes to mind is a project that we've just recently completed, looking at doctor-patient communication here in Singapore, really through a lot of different types of qualitative methodology, which really helped us to uncover exactly what happens in clinician settings and really how the conversations between doctors and patients evolve in our part of the world. So one of our findings is that while the West is very much centered around what you call doctor-patient communication, which involve two persons, so a dyadic communication. Here we have a triadic or even quadratic situations are very common. There is typically a companion, and different types of companion can be with the patient. And in that space, it really changes the dynamics of communication. And there are both cultural and non-cultural facets to that. And oftentimes we find that when there is an additional person in the room or persons, the dynamics change in such a way that sometimes the doctors may even focus not on the patient, but on the companion in the conversations. So this was really interesting to us. Yeah. And so, so that's one of the projects where we see that there's very clear distinction in terms of Asian communication patterns in doctor-patient communication. Yeah. Another area that we've been doing work on is the communication of food for health, right? So again, when we want to promote certain types of food intake, for instance, proteins, and how that should be communicated in terms of its benefits. Again, in the West, it's a lot of it is very cognitive. That means we have the food labeling, and you talk about the different, about different types of nutritional benefits.
Yeah.
That you would see typically in a food label and so on. And I think that that's something that is also used here in Asian context, but the type of nutrition literacy in the populations is a lot lower.
Mm.
And other factors like word of mouth, or, what this food means in a symbolic manner to the Asian, population in question is is often more important than
Mm.
some of the nutrition facets
Yeah.
that comes out on the labels, for instance, right? So, I mean, of course, I'm kind of shrinking, this very, deep and broad set of research that we have
Yeah.
into just a simple explanation. But I think here in these two projects, you can see how different our research findings are, and what it also means to, policymakers, health educators, yeah, and health communication at large.
Yes, absolutely. And I mean, that gives I mean, obviously we only have so much time, but you've given there a really good flavor, I think, of the different types of projects that you're working on at Nanyang. And I mean, there's the MOBOS project and the work on the triadic and quadratic uh interactions. Oh, there she is.
So
And then
sorry
also
for the
food
interruption,
labels.
because I've let her
That's
out and
okay.
I've closed the door, so she's going to be barking. But if you don't mind, we can just continue and let her stay there. Yeah.
Yeah, that's
Uh,
okay. But obviously you're working across lots of different areas and different types of texts and contexts. Could you tell me, maybe just to close, what your plans are for the next few years? Are there any particular research projects that you'll be starting or planning for the future?
Yeah, yeah. I think that I did a lot of research around COVID during the COVID time, and really we are now in a post-COVID environment, and uh, some of the challenges arose during COVID, and they stay with us. So one of the programs that I'm involved here is to look at the decline of mental well-being amongst the populations, and especially with our young people, how that is fueled and related to media use, and the lack of cyber well-being know-how, etc. And so we have a new program that's looking at the interface between media exposure, social media use, and the young. So
Mm.
that's going to be one area that I'm involved in. And at the same time that, while we talk about digital media and some of the negative effects, I also believe that there's there's many opportunities to use this positively for health as well. So at the
Mm.
same time, we are also embarking on projects that uses technology, which includes AI and big data analytics and so
Mm.
on, to understand the population and the behaviors better, especially here in Asia, and to see how these tools can help to nudge behaviors, especially behaviors that would bring both physical and mental well-being.
That's fantastic. And I think what's clear from everything you've shared with us today is that your work has a really applied focus, and clear real world benefits, and it looks like that's going to continue as well. So I'm really looking forward to seeing how that work unfolds. So yeah, thanks very much, May, for taking the time out with your little dog in the background as well.
Yeah.
So
Thank you.
yeah,
I'm so sorry about that to all our listeners.
oh, that's
Thank
okay.
you for bearing with me. Yeah, she just wants to sit under the table, next to me whenever I'm doing a Zoom meeting. So appreciate your understanding. Thank you.
Oh no, that's part of the human side of it, isn't it? And I think people appreciate that too. So thanks again for your time, and yeah, catch you all next time. Bye.
Thank you so much. Thank you for listening too. Thank you. Bye-bye.